Hi, my name is Michelle Winfield. I'm one of the co-directors along with Dr. Michael Snow of the Master's degree in Integrative Anatomical Sciences. The Integrative Anatomical Sciences Master's in Science degree is a program that focuses intensively on acquisition of knowledge about human anatomy. So we focus on gross and clinical human anatomy through dissection, as well as microanatomy and neuroanatomy. These courses are given by people who are acknowledged at USC to be top in the field at teaching, and the primary focus, besides our intensive knowledge of human anatomy, is how to teach human anatomy to others. So with this knowledge base, you could go into medicine, you could acquire a teaching job in anatomy at a community college level, high school, so forth, as well as utilizing this as a skill in case you wanted to go on to a PhD in some subject and have teaching as part of your skill set.
There aren't many programs that provide a specialist training background in anatomy to begin with.
Anatomy and its application to being a doctor, to me, sort of put a real focus on what I was doing. And learning anatomy as the purpose of what you're going to do to help take care of people really makes it a lot more interesting and more inspiring. As you look at the branches of the internal maxillary artery, they actually become part of my practice now, and those are things that I learned in the master's program.
Much of what I do is really just applying anatomy, applying my knowledge of anatomy to problems. So it's a real core discipline, and not a lot of programs focus on that.
The power of understanding that your knowledge will someday be converted into sometimes a life-saving or limb-saving solution to a patient, that's very powerful.
It's everywhere from medicine to research careers, from biomechanics to physical therapy to medicine, you name it, anatomy is a part of that.
Teaching is really rewarding in a very short-term kind of way, and that's a nice contrast from research, which is very slow. My studies take several months usually to complete, and then there's time to analyze the data and write it up, and then eventually it becomes published, and that may be a year or more. Teaching, on the other hand, gives you that sense of connection that can be over the space of minutes.
Teaching allows me to get better at what I do. It makes me more of a master of my specialty and my craft.
So all of my research is on anatomy, and all of my teaching is also on anatomy. So there's this nice symbiosis really between my teaching and my research, and they both inform each other.
So teaching kind of comes as a part of an academic position in a medical school, in that you do research, you do teaching, and you do some committee service. But I fell in love with teaching. I'm a very sociable person. I love the interaction with the students, and I found that I was able to help students that were struggling with anatomy and sort of turning that around for them and making it more logical, less memorization, were all things that were extremely satisfying and have been for 47 years.
And so one thing that we offer here that's actually really interesting and unique is that we have a dissection-based anatomy course, so students, graduate and medical students, get to learn anatomy through the dissection of a body, and they get to actually see what the inside of a body looks like with their own eyes and not have to rely on ultrasound or X-ray imaging.
This coursework is taught on the Keck School of Medicine campus in the Keck School of Medicine facilities by Keck faculty. And the advantage of this is that you are obtaining a world-class education in anatomy and utilizing these facilities and being able to teach medical students. You will be reinforcing your knowledge and your ability to teach.
Having a master's where I spent a lot of time as an educator I sort of developed an interest and some level of expertise in it, which ultimately developed into research projects and into international programs where we teach orthopedic surgeons how to do plastic surgery procedures. So the things that I learned in my master's program ultimately translated into things that I could teach other doctors to help their own patients, and that's been a huge part of my development as a surgeon.
I think what this program will offer our graduates is the opportunity to feel confident as teachers and to feel that they can have the mastery of the subject so that they can convey it to other people.